Thank you, Mr. Chair and members. My name is Matt Cate. I'm the Executive Director of the California State Association of Counties. We represent all 58 counties in California. Appreciate the opportunity to address you briefly. If I could address the current state of the law first. The 58 counties believe that unanimously that the Coordinated Care Initiative was a good idea, that we believe that it's helped people, that making sure that IHSS clients were able to get the best possible care through managed care and through coordinated care is the right thing to do. It has saved money, undoubtedly. Next year, it appears it will be around $42 million short, according to the numbers we've seen. Our view is we need to reinvest in the Coordinated Care Initiative, redouble our efforts, especially in Southern California, where we haven't seen as much success as elsewhere, and give this another try. That's ideal from our perspective. We are very concerned about the current state of the law and the shift of the $623 million to counties. I think it's important to note that not all counties are in the same position economically. While there has been growth in some counties where Silicon Valley has done well and in Southern California in some places, there are many others who are doing poorly. And this would have a devastating hit on those counties, the current state of the law. As you know, Mr. Chair, it's a $25 million hit to Fresno County. That should triple. Orange County, 38 million will triple, 220 million in Los Angeles, which will triple. But I think the message that people don't understand is that places like San Bernardino have seen their property tax revenues decrease 10.8% since 2008. And in Fresno, they have 8% less in property tax revenues per person than they had in 2008. Some have modest growth. Los Angeles, almost 5% since 2008, not a ton. And then I think the other thing that's important to remember is that counties are unlike other people or other groups that sit before you. Counties are a subdivision of state government. It's our mission to implement the laws you pass. And in order to do that, we need to have the funding necessary to provide that care, to be in the field every day with our partners in labor, with our partners from the other affiliate organizations to do this work. And so that's our primary concern. We are also concerned about not only the size, but it's been difficult for county supervisors to get their minds around the fact that the program has not only grown, but in ways that the counties didn't control over these last 5 years. And that's going to be true in the future. And so those points make it very difficult as we focus on homelessness and mental health and public safety reforms and all the things that you've asked us to implement. We need proper funding to be able to do it. We think CCI is a good idea and we should keep going. I would like to make a few points about the proposal that has been brought forward by this body. I would say that there is no question counties believe that an MOE is appropriate. And so returning an MOE for future years at the same level we've been at the current year, we think is undoubtedly helpful for us as it allows us to buffer the increased costs that we see coming, that everyone sees coming in this area. We also think it's a good idea if costs are controlled, that we think the state should and could bargain on behalf of all the entire state, all 58 counties. Again, if MOE is in place, those are both things that we undoubtedly agree with. As I mentioned earlier, the $623 million has hit us in the face, and I cannot say that we are at terms with it. It feels too large for us to be able to handle. and it will take years to be able to deal with that even in the current year. Interested in all ideas around smoothing, around ways to mitigate. We have been talking to the administration. We have been talking to staff about all of those ideas, and we remain open-minded. Our primary concern is for the same people that you're concerned with, and so being able to work together over the coming weeks and months, I think we would appreciate that very much as we try to find a solution that works long-term for us. Thank you very much.